everybody, welcome to day 21 of Waxvent, and I think we've got I got a good one for you today. Count to 1, 2 mastoid cavities in the same video. I know, right, so this first one here, patient had gone to the hospital to get their ears cleaned out and was told, I'm really sorry, but we can't get it out. You've got a big piece of wax in there, but we're struggling to get it out. So you're going to have to sort of come back. And he really didn't want to because it was causing lots of irritation in his ear. So first of all, we start off with, well, it's actually, it doesn't look that bad. Entrance ear canal's coming out really easy. I can't see what the problem is. I was like, oh yeah, I can see there's a little bit here. Oh, is this? I'm sure this is the mastoid cavity. I'm sure it is. But yeah, so I can see this little bit of wax here at the base of the canal. Let's lift this out.
You always get some in that like shelf then you're at the top, that right in the corner.
Yeah, Taylor Green knows what's coming.
Yeah, I've had a couple of deep ones myself, and it's.
I was like, oh, hang on. Right, there we go. That's what we were looking at. Okay, so I said, we have got a little tiny bit of wax just to this right-hand side here. It's kind of just at the entrance to the cavity. And then started to pull it. And there was a bit of skin. And I was like, okay, there you go. A bit more skin, a bit more skin. I was like, oh, well, yeah, that was a chunky-ish piece.
Oh,
and then I see that.
Oh,
no. Right up here.
Oh, that's a deep one as well.
That's not an easy one to get to. It's literally right in the cavity, right at the back, right at the top corner. So I'm like, okay. So yeah, first thing to do, drop the stool down a little bit, give me a bit more of an angle, and then kind of working my way into this. And I thought, oh, okay, well, fingers crossed it's not attached to anything. And
they're incredibly sensitive in this area as well.
They are.
With mastoid cavities, it is very kind of complex. Because it looks nice and easy, but it is really complex because it causes some patients to get really, really dizzy, doesn't it? With
that's what happened with this patient. I did have to stop it because I said, because I did say, if you feel dizzy, you're giddy, anything, just let me know. And as soon as that plug, as soon as it started to move across, you went. Whoa. I said, okay, let's just stop there for a minute. I think we had about a 3 or 4 minute break, and then went back to it and I said, look, if you feel giddy again, just let me know. But yeah, look at the size of this. I just don't understand how the hospital couldn't get that out. I know, it's huge. Absolutely. I mean, that's been in there for a long old time.
Yeah. Because at one point, a lot of patients who had mastoid operations, mastoidectomy, were getting seen regularly in the hospital, so like every 3 months, I think it was. Was it?
But I think they were 6.
They
were 6 months, but every so often. But and I think this gent still is under the hospital. But in fairness to him, he said they told me, they can't get it out. But they said, we'll get it out next time. And he said, but I waited almost 18 months to get that appointment. So he said, I'm going to be waiting a long time to come back in again.
Understandable.
Yeah. But look at the size of this, because it just...
It's a stretchy one as well.
Yeah.
It's weird.
It looks like a raisin.
Yeah.
It's got that sort of feel to it. Like a mixture between the texture of a raisin and a sultana. It's that kind of texture. I don't know why I didn't clear that little bit of wax off. Oh, there you go, I do. I was like, why didn't you clear that off? You've got a better view. So here we go. So go on edge. I'm really... Oh, don't go back in.
Don't push it.
Don't go back in. Nah, don't. So I've got a grip. Let's pull him again.
Yeah, it's a good one. Oh.
I think it does. I think I have a couple of goes at this because every time I get a grip,
it just shears through it.
It just starts to shear. So I had to reposition a couple of times. Now it's stuck. So I've just got to kind of grab. Look at this, look at this, look at this. I dropped back to even give you the full effect, like Taylor Green. It's stuck in the jaws on that first. Like, it's just going to clear this off a minute.
Oh, wow.
Look at that.
It didn't look that big, to be honest.
No. And I was like, okay, let's have a little look. There we go.
It's much better though.
Yeah, there's a little tiny bit of dry skin in there, and I think... Oh, I think I cleared. I think I do a quick clear up on the other side, just because the patient had a little bit on the other side. So I think we just do a very quick tidy up on this one. And a good
Did
look
you
at
have
that.
any hearing on that side with the?
Yeah, he's got a little bit. You're saying obviously this is his dominant ear. This is his kind of main ear, if you like. But the other side is there's very little left in there.
Because that was he's had like the radical mastectomy where they cut away all the
they've
bone
done a
and,
lot. If you like that one, you're gonna love the next one. Yeah.
2 in 1.
Two. I know. Look at you. You're getting a twofer.
Yeah.
A pog off.
Got thick hour. Pog off, yeah.
An inch worth of wax plug in that one.
Oh, that's all skin, isn't it?
That is all skin, Taylor Green. And this was lovely. I really enjoyed this one. As much as I looked at it, I went, oh, what? No, okay, where do we start with this?
That's all going to peel, isn't it?
You can see me having a good old look around, thinking, okay, right, so we're going down there. Oh, I can see a little bit down there as well, in another awkward corner down that bottom left corner. And then we got this kind of piece by here. So I'm having a good old nose around now, so getting the lay of the land, seeing where we go with this. So I can see we've got this flap on the left-hand side here. My patient was talking to me a little bit there. So I start and I think, oh, okay, perhaps this is literally just like a little bit of skin.
Yeah.
So I want to try and extend this, try and sort of flatten it out a little bit, just so I can get a better grip with the standard size Ornatube. Now, in fairness, this patient, I've never seen this patient before, and they said to me, oh, obviously you can feel a bit giddy. He said, look, I've been having this done for the last 30 years. He said, never once felt giddy. I was like, oh, bro, okay, that's good. I said, well, it can happen, especially with this sort of wax, this skin peel we're doing now.
Yeah.
So you can see them. So basically, the reason the skin is formed like this is we talk about epithelial migration, a movement of the skin out the ear canal. Now in this, it's got a longer way to go because it's got to go all the way into the cavity and back out again. So it's going to dry a lot quicker. Awkward angle for the forceps. You can see I'm trying to just lift that bottom section up there.
Yeah. You want that to be like kind of more facing you a little bit on edge than you. It's.
Watch this now, take it. I think it's by here.
Ooh,
yeah.
Another good grip by here.
Yeah.
Oh.
I pushed it down, man. Like sometimes I'll go in with the forceps closed and just push it back up and then go back on with the forceps. You can see I'm trying. Either I've got to grip an edge or I've got to fold that piece. Oh, there we go. That helped.
It's like deeper than it looks, isn't it?
It is. I thought we were just going to have this sort of front section here.
Yeah.
So I'm just going to peel a little bit more now with the suction. Look how dry that looks in there as well. And then back in now with the forceps. I should have really left it at a better angle for me to grip.
Oh, that's it, reposition there now.
Yeah.
Nice grip there.
And again. And again. It is coming, guys, I promise. Apart from the fact I keep pushing it back into the wrong position all the time. Don't forget, we're working almost out of, if you imagine this is the ear canal from your end, you're working kind of in there at an angle, at a really extreme angle, so it's difficult to get the forceps around that corner. And this skin naturally wants to return to its original position.
Yeah, that's the one. Yeah, that's a good one. There it goes. Oh, it's ripping.
Yeah.
It's like paper.
Look.
Oh.
Right, so we could see that dry layer in the bottom left corner.
Yeah.
Yeah. Watch this. Watch this. Look at this. Look at this. Look at this. Ready? So that was the brown piece. We could see the bottom left-hand corner. But watch.
Ooh.
Yeah. Still going. So we're basically clearing the surface layer out of the cavity here.
Oh, that's going to go right the way around, isn't it? That's going to... How thick? That's...
Yeah.
Oh, come on.
Look at this, Taylor Green. Look at it. Look at it go, boy.
Oh, I can see it all that. Oh.
Look at that, Taylor Green.
Oh, they're the best ones, aren't they?
We've basically stripped the entire cavity of skin. Look at that.
Jeez.
Look at that, Taylor Green.
Oh.
Doesn't just stop there, guys. Don't stop. Look, we got this piece to get out now.
Oh, wow.
The forbidden cornflake.
Oh, it is, yeah.
I'm like, oh, okay, I'll have it. Right, where do I start with? Because this is going to be ultra sensitive for the patient. Where do I start with this? Let's see if we can. It almost looks like a pancake. It's got like a crepe.
Stop ruining
I know.
nice food. You said all the really nice food.
I know. So it's going. I was thinking, oh, I'll just peel the edge by here, but it fine end just wasn't enough power. Really didn't want to lift off. I was like, oh, okay, right. Let's try somewhere else then. You can see I'm looking at, okay, where do I go next?
I would have probably gone back to that right section again to see if it, because it looked like it was slightly detached underneath.
Like a bit of an overhang, do you think? Yeah,
maybe just try and lift that a little bit. And that bit there,
yeah. Try this one. Yeah, what would you lift it with though?
I would have tried with the suction.
Yeah.
And then gone in with the forceps.
Yeah. That's what I do as well.
Oh, perfect. Look at that. Oh, that's coming away nice, actually.
I was like, oh, that's a bit of all right, that bit. Let's see if we can get this next bit now.
Oh, yeah, that's the one. Nice and gentle.
All the way along. All the way along.
Like a sheet.
Yeah, everything. I was like, oh, okay. A little bit of fresher skin there underneath. And
oh, look at that.
all from the inside of the cavity as well.
That's like the,
ta-da!
That's like the perfect mastoid.
That's a lovely clearance there is. There you go. And all that skin's gone. Told you to wait for the second one. Told you a good one, didn't I? Look at that skin. 1.5 inches of dead skin.
And you can see, just by looking at the ruler shots, you can see just how wide the ear canal goes with those operations, because the wax is normally about this thin, but it's like this when it comes out on the ruler.
Chunky. I love a good skin peel. I think that's one of my favourite ones.
That was a good one.
I like that one. That was a good one.
I like that one.
Well, guys, thank you very much for watching our day 21 of Waxvent. I hope you enjoyed it, watching it as much as I don't know what to tell you. I loved doing that one.
I enjoyed watching it.
That was a good one. So, as always, guys, no, hang on, mate. If you do enjoy it, always like, heart, share, follow, subscribe. If you thoroughly enjoy the videos, become members of the channel, guys. You get to see more videos as well. Until next time, take care of yourselves.
Take care of your ears.
And take care of one another. Myself and lovely Miss Taylor Green. We'll see you for day 22 of Waxvent. Bye-bye.
Bye-bye.